No, ventral gluteal is back here on our vastus lateralis. We're using the vastus lateralis in a newborn because that's the only muscle that's actually developed. We're not getting, there's nothing on their hips. They don't start putting really gaining weight there and tissue there until they're about 18 or 2 months old, 18 months or two. Okay. Assessing a baby for jaundice and using the little Billy flash. Doing a fundal height, which I used to demonstrate, but again, it's a great little video and you can actually see, and if I do it on WebEx, you're really not gonna be able to see that well, okay? So I put a list in Blackboard and I'm gonna show you of watching those videos and you're just gonna click reviewed, and it's an honor system, and it'll just help you. The more you can watch, the better it will be, okay? There's one on assisting with an epidural. I'm gonna tell you, it's I hope you guys get to see an epidural. It's a big honking needle. It's a big honking needle they're sticking in somebody's back. And so sometimes people get a little squeamish. Make sure you eat before you go to clinical. But if you've seen it before, then you kind of know what to expect. And the CRNAs are great at kind of explaining what's going on. Here's an APGAR score, baby vital signs, circumcision care, and then there's a cesarean delivery and a vaginal birth. So you can at least kind of see what it looks like before you're in the actual situation. And that usually helps a little bit, okay? Otherwise, I might look at course point later on in class for everybody, but there's all kinds of good stuff in here. The PrepU things are the only things that I'm assigning. The VSIMs are in there and we'll use them if needed for makeup clinical days, but if you don't have to use them, you are welcome to do them. They've got, you remember, they've got a little pre-quiz and then a post-quiz, and so it's a good way to study. So if that's, that might be helpful for you. The Stedman's Dictionary is pretty cool. Should have that for health assessment because they're like 10-second videos of like what is happening with the muscle when you adduct or you abduct. And so I think it helps sometimes with the terminology to put a picture with it. Okay. So you've got all kinds of good info there. Look at this Lippincott advisor that you have access to. You've got a drug list, you've got care planning problems, you've got signs and symptoms, diagnostic tests. It's all there, what do you want to look up? You can look at all this stuff. Here's an A1C, okay, and it will tell you about that. So there's some really good, resources in Course Point, okay. I think so. I will verify. 12 months? Yeah. Which should take you through transitions because it'd be good review, right? And I noticed that there's also, like in the videos, there's also some reviews of heart sounds and lung sounds, So, I mean, if you want to use for those for med surge, that'll be good. And then look, they've even got some stuff on culture on sentinel events, core measures. So, I mean, there's some good stuff here, there's your drugs. Okay, so let's talk. I've not looked up the drugs here. Let's look up Cytotec and see. So I sent out an announcement on drugs. Misoprostol. Yeah. Okay, good. So this has the way we use it in OB. So Cytotec or misoprostol is actually a GI drug that is used for GI upset, but it also causes contractions. And so we use it to ripen a cervix, and we also use it for postpartum hemorrhage. So it's a little tiny pill, and it comes in 25 micrograms or 100 micrograms because it's FDA approved for GI upset, right? When we use it for postpartum hemorrhage, we give 800 to 1,000 micrograms. So it's like one of the only times ever that you would actually give 8 pills, right? Usually, when I have a student that comes up and they're like, I did my drug calculation, I'm giving 8 Tylenols. I'm like, nah, no, I don't think so. I think you did your math wrong. Let's go back and look, because nobody takes 8 pills at a time, right? But for Cytotec with a postpartum hemorrhage, we actually do. Okay, and it's because it doesn't come in at 500 or an 800 because that's not what it's FDA approved for. Okay, you'll notice too that it talks about how it's related to labor. And then it also has some information on how it's used in abortion. So you can just put in your head that it's one of those drugs because it contracts the uterus, right? But we are not doing abortions. That is not our purpose. We are not going to be helping with them or taking care of patients in the hospital that have them. And so that's not the use you want. You want to look at how we're going to use it in the hospital, which is for ripening a cervix or postpartum hemorrhage. Okay. Epocrates is another option for you for using, for looking up your drugs. Has anybody gotten Epocrates? You can get an app for it on your phone. It's got a big E. And you can look up a drug there, and I have found that very useful and helpful. Some of your drug books will not give you the OB use, and so look it up in your textbook is a good place too, okay? To look up those drugs. Okay, let's go to Blackboard. Okay, so I'm probably gonna have to log on again. So we are just going to quickly go through, yep, what you have to do for orientation. Oh, look, I already have 9 emails in. Okay. Okay, so here's your clinical information. Okay, this one right here that says clinical forms, every piece of paperwork you need is under here. But I've also put it in the modules, so you can get it either way, either place. Okay, so your care plan and your evaluation stuff is there. Okay, if you are going to spawn, you have to do a survey and show them a code before you walk into the building. Okay, so you have to answer the questions and take your temperature. And so the information to get it to the website is there. If you are at Bay Area, Professor Gomez is saying they're having you do that when you walk in. And so you'll just scan the QR code and answer the questions. You're supposed to do it within 2 hours of arrival. Again, I only did it once because I only went to the hospital once last semester. At Spawn South, I usually get there at 6 so I can see what's going on before the day shift comes in. And so you have to go in the ER entrance by outpatient surgery. But I'm pretty sure at 6:30 they open up the employee entrance, which is back by where the employee parking lot is. And so your faculty will talk about where they're going to meet you and how you guys are going to get in. Okay, so that's an added element that's helped us a little bit. Okay, the orientation is there. Okay, I'm going to open up the Sim Wiki, not right now because you guys will all go and sign up. Okay, it's hidden right now, but I'm going to open it up as soon as orientation is over. Okay, and so this is what it looks like. Okay, so you guys are going to do a simulation. Did you guys do a simulation of fundamentals? So this is going to be your first one. Okay, well, that's okay. We have fun. We are very learning oriented, and we are not going to try and trip you up. And if you're doing something wrong, we're going to come up behind you and say, no, do it this way. Okay. And we found last semester we had to do a lot of teaching in the first rotation simulations because they hadn't had clinical, they'd already finished med-surg, but they hadn't been in the hospital, and they hadn't been in the hospital for fundamentals either. So we're going to help you on that. But your simulation, you're going to sign up in groups of 4. We're running them on the 16th and 17th of February, which is a Tuesday and Wednesday from 8 until like 12:30 or 1. You do not have to be with your clinical group. The way it's going to work is the lab has done a great job with social distancing. So we'll have like a check-in area where we will kind of talk through your preparation work. Okay, what would happen if you had a postpartum hemorrhage? What drug are you going to give first? Okay, what if she has asthma? What drug are you going to give next? What if she has high blood pressure? What's your option for a drug? What are you going to do with a baby? Well, we're going to kind of talk through the scenarios. Okay, then your group will go to the simulation, which will be one of our dummies, little Noelle, who, and you'll get bedside report, just like you would in the hospital, from a faculty who will be the nurse, right? And then the nurse will leave you for a little while, and your situation will unfold. So with the 4 of you, you think about, somebody's going to kind of be in charge, the team leader, somebody's going to record, Somebody's going to do the catheter, somebody's going to massage the fundus, somebody's going to go have to get the medication, somebody's going to have to call the doctor. So you're going to have to kind of communicate on who's doing what. Okay. It runs about 15 or 20 minutes. And then when you're done, you get to, talk about it and say, this is what we did really well, or, I wish we'd have done this faster, or just kind of go through the things that you did. Okay. And then as a group, you will document in EHRs. Everybody has an EHR? Okay, I'm not going to check it. I mean, I'll go through and look at some of them, but it's not a grade. I just want you to practice documenting. And so as a group, one person needs to log on to EHR, and you're going to document in EHR the interventions that you did and an SBAR just for practice. Okay. And then you have a little survey afterwards. So that's OB simulation. You have some prep work. And some of you have probably already looked at it. See, it says student preparation for OB sims. Okay. So I'm going to tell you, you're going to look up some information. What drugs would you expect to give? What would you expect to do for a baby that needed to be stabilized? What would you expect to do for a postpartum hemorrhage? Professor Goloczewski, she made an escape room. So we're going to try that. It's not, it's just a different way to look at it. Okay, so that's part of your preparation. The blood transfusion stuff, we're going to take that out. We're going to do it because you're not even going to do the blood module in Med-Surg until week 5, and the sim is week 4. So we're just going to take the blood transfusion piece out, and we'll do it in Med-Surg later. Okay, so you don't have to do that. And then I actually have a couple of videos of some postpartum simulations. One that goes very, very well, and one that is one disaster after another. Okay, and so you can kind of look at those and just to get an idea of how it works, and what you might be doing. Okay, so that's OB simulation. Okay, orientation. Oh, go ahead.
The sign. Oh, I don't know why it's the sign-up sheet that you just had up. Is that underneath? It's the Google Doc one.
It's a wiki, and it is not available to you right now. You don't see it.
Okay, I just wanted.
Yeah. You're right. You don't see it, because if I open it up right now, you guys are all going to stop listening to me. You're going to go in and sign up. Right? Yes. Okay. So I'll open it when I'm done, and then everybody has fair game to go in and do it first. Okay. Okay, so you guys already know how to do a YouTube video because you did your health assessment videos there. Okay, so some of you have already looked at this. So I tell you, we did these videos. We couldn't come back after spring break, right? But the faculty came back, and like we threw these things together. This is what I usually demonstrate. Okay, so Brayton, helped me film. And so you have the video of me doing an assessment, and then the lab went back and made them into learning modules, and they're kind of cute. And so you have a little certificate of completion, but they spiffed them up a little bit, right? Tell you what equipment you need, and then there's a couple of questions to answer afterwards. So everybody needs to, that's the postpartum exam, so instead of watching me do it in person, you're going to watch me do it on the video and upload your certificate. Same thing with the baby. You're going to watch me do a baby exam, and then you're going to upload your certificate, and then you are going to video yourself doing a postpartum and newborn assessment. We used to do that in checkoffs and have you come in pairs. There's 65 or 66 of you. There would be 7 or 8 of us faculty here doing checkoffs, and we just can't make that work with COVID. So we're going to do it this way. Okay. Again, I'll tell you in the video that, use whoever you've got. If, a roommate, a spouse, a significant other, a boyfriend, a girlfriend, pillows, stuffed animal, whatever you got. I mean, the point is to have done it before and talk through it. You can make some cards to help you out. I showed you my cards, but when you come practice, you can look at the cards. I've kept some other people's cards. So these are my cards that I made. Okay. Just simple for me to look at and say, how would I do it? Okay. And with the postpartum assessment, we think about BUBBLE-HE as an acronym, so top to bottom. So I start out with my vital signs, and then I use this acronym, and I did, I did all of my auscultation first in my vital signs, and I did my auscultation, heart, lungs, bowel sounds, and then top to bottom, breast, uterus, bowel, bladder, lochia, episiotomy, and helmets. Okay. So I just want you to take a picture of these so that I know that you made some note cards. You can use these in your video. Okay, you do not have to memorize this stuff. Okay, just again, to be prepared so that you have an idea of what's happening when you see it in clinical. And then when you come for your practice session, I have, other people did different ways, so you guys can look at that. Okay, question from, Sasha. So we have 7 E-line students that are joining us for clinical. You are welcome to come for simulation. I highly encourage it, but sometimes it doesn't work. Some of our E-line students are living in the valley, and so it may be difficult to do that. And so we'll probably just substitute a VSIM. But simulation's fun. It's fun. It's entertaining, You can listen to me have a baby. Okay, here's this, you guys, this is pretty easy. This is prenatal game for nursing care. I do want to show you on this that I'm only assigning under the maternity, I'm only assigning the prenatal one, but there's a labor and delivery, a postpartum, and a newborn one. And so it's just a different way to study if you want to do that. And then there's also, because this is free, it's got peds and med surg and ER, so you might be able to use it for something different. Okay, so you can either play the game or you can do the learning modules. And the little learning modules have, little quizzes and, stuff like that, fill in the blanks, drag and drop, stuff like that. So it's good, it can be good studying, okay? When is the postpartum checkoff? You should be able to do the checkoff within a week. So I think next week is fair. If you have a conflict and you need to do something different, talk to your faculty, okay? The medication assignment we've already talked about. Oh no, we haven't, well, I forget because I've already got a group. Who have I talked about? Here's my medication assignment. Let's see. Okay, now I have to share a different file. Hold on. Stop sharing. Next week. Yeah. No. Next week, because some of you are Wednesday, Thursday, some of you are Tuesday, some of you are Friday. I think a week is fine. So what, maybe a week from Saturday? Is that fair? If you have problems with that, talk to your faculty. No, no, no. Those of you that are going this weekend, there's no way. If you have clinical tomorrow or Saturday or Sunday, there's no way. Yeah, yeah. I mean, it'll take you a little while to get organized. Yeah, you're just going to make a YouTube video and upload the link. Okay, and then we'll watch it. And really, we just want to make sure that you're hitting the high spots, right? So like, I think we had somebody that did a newborn assessment in 2 minutes. There's no way to do a newborn assessment in 2 minutes. Okay, that's not enough. And we said you need to redo it. Okay, but otherwise it's general. You can do 2 videos, one for each, or you can put them all on one. I don't care, but it should take you, I mean, it should be like a 10 minutes, 7 to 10 minutes by the time you go through it. Okay. Okay, this is your med sheet for clinical, which is different than the mini med that people were asking about in class. Okay, you guys, this should look familiar, right? Because this was kind of what you used in fundamentals. Okay, so in fundamentals and in med surg, you only have to write up the meds that you give. And often in med surg, you go the day before and you have an assignment so you know who your patient is. But we have no idea who you're going to take care of, right? I mean, sometimes it changes that day, that hour, right? People show up, people have babies. And so we're going to be prepared for anything. So you are going to draw, and you have to know all these anyway. So you are going to look up all of these medications. And this is what I'm talking about. You have a week to do this. Talk to your faculty. Okay, so for my group, I want to see that people have done it. So they may show me in person, or your faculty might have you uploaded in Blackboard. In which case you're just going to get a check off that it's done. Okay, but the goal is for you to have done it, and then for us to have a discussion about it, and for you to fill in the blanks. So this is the 10 points on your 3 care plans for medications. Okay, so everybody should get the full 10 points after we discuss it, right? Because we're going to fill in all the blanks together and say, oh no, don't forget about this, or no, that's wrong. Just to kind of talk through them. Okay, my preference is that it is handwritten, because you don't learn anything by copying and pasting. That's just my preference. Okay, I'll tell you that, I know this is supposed to be your assignment. This is not supposed to be a group assignment. I have known people groups where they split it up and then they all merged it together. And it's very obvious when that happens, when everybody talks about, instead of a placental abruption, a placental explosion, or instead of foul smelling fluid, FOUL, they write foul, FOWL. But really the important thing is that you have to know these drugs, right? I already know these drugs. So copying and pasting to make it look pretty for me is not going to help you, right? So handwrite it, be essential, okay? Um, that's my little spiel on that.
So will the attachments to the care plan?
Yeah, so that's what I'd like. I'd like to see that you've done it, and then when you turn in your labor and delivery, some students will just give me the whole thing and say it's done, and I'll just make a note and say, okay, I'm giving 10, 10, and 10. Some students will actually turn it in with a care plan. So ask your faculty what they want you to do. Okay. Okay, hold on, let me stop sharing. Okay, now let me share again and go to Blackboard. Hold on. Sorry, you guys. The joys of WebEx. This is the new revised WebEx, which gives me many options on Windows to share. Okay, can you guys now see Blackboard again? Yes, okay. Childbirth class attendance, everybody is required to attend 2 hours of a childbirth class. A lot of you guys have already done it. You need to do it before your clinical is over. Most of those classes are Monday evenings. There are some Tuesday evenings. She does some Saturdays. If you just go to the website, you can sign up for a class. She asks you to register 24 hours in advance. If you don't do that, you can email her and she can send you the link. And she just sends me an email afterwards and gives me a list of the people that attended, and then I just put a check mark there, okay? Okay, then there are all these zillion videos, which a lot of you guys have already done. And I know it looks like a ton of information, but it's really not that bad, okay? Okay, so the PPE module, you guys probably did before, but we can never have too much review on PPE. It's not showing Blackboard? Shoot, what is it showing? Nothing? I might have to change my view. Okay, great. Okay, I'm gonna try sharing again. So it might be you. Okay, it shows for me that I'm sharing Blackboard. You got it? Okay, yeah, see the joys of WebEx. We just have to keep each other, help each other. It's almost always gonna be my fault, so it's good to tell me. Okay, this little Kellogg breastfeeding thing, you're just, well, let me show you what it looks like. You guys have my view, so hold on, let me make. Okay, this is how it looks for you guys. Okay, so when you're done, you're just gonna click reviewed on it. And then there's a way for your faculty to look and see that everybody's done it. It's just a check mark, a way to look up, keep up with it, okay? Okay, this little clinical orientation video and quiz, I almost took this out, but because I didn't used to have a childbirth video for C-section and a vaginal delivery. So you guys are my first group to be able to look at it on VSIM, so you can give me some feedback on whether if the VSIM stuff or the course point videos are better than this is. Okay, but when you get to this one, I had a graduate student do this for me a couple of years ago. You have to hit start. And then there are these 2 links that are gonna, when you hit it, it's gonna say, do you wanna leave the page? And yes, you wanna leave the page. And you're gonna watch the video and watch each one of the videos and then come back and there's like 20 questions. Okay, so you just need to get a 70. Again, it's just to give you, just for you to see something before you actually get there, okay? I believe that these, you can tell that these were probably done in the 80s. So I think the course point ones are gonna be better because they're gonna be more current, okay? But we're still gonna do that. Okay, so let's see. Then we have these, and we have these other videos, so this is Dr. Olenek and I, you can tell that my hair was curly and I was thinner and tan. So you can watch those. The sterile gloving one, I think I did that one great in last semester. And so they're short and to the point. Here's where it says course point video. You're gonna go in and actually watch it in course point, and so it's just a way for you to check off that you've done it, okay? Okay, some of the videos, probably the ones that I did with Dr. Olenek. Yeah. Yeah, that one I did with Dr. Olenek. If you have a Mac, those don't always pull up. They pulled up on mine. And so if you're having a hard time, you have a Mac? Yeah, that's why. And so you might want to use one of the library ones or one of the computers here to watch that. It's not very long, but that's why. I checked them all and they work on mine. So it's the Mac. I don't know why. Yeah, it's picky. The fetal monitoring, we're not actually going to talk about fetal monitoring until intrapartum. So in class, we're not going to talk about it for 5 or 6 weeks, but you're going to see it in clinical, right? And you're going to have to document some of it on your assessment. So you want to have some idea, and the nurses will help you and your faculty will help you. So this basics one, this was actually a TWU professor that let me borrow her video. I think she did a pretty good job. The other one is that registered nurse RN that does all those people. She's very peppy, right? She talks very fast.
Southern drawl.
Yeah, y'all. I'm gonna show y'all how to do this. And so it's got a little quiz afterwards. And so hers is just a little different. It will just help you understand what you're seeing in clinical. And then when we do it in class, it'll make more sense. Okay. There's those other videos. Okay. Where it says postpartum assessment Harold and newborn assessment Harold, those are the same videos that are in the modules. It's just, if you feel like you need to watch that again before you do your own as kind of a practice thing, you don't have to go through the whole module. That's the only reason they're in there. Okay, so you don't have to watch them if you don't need them. Okay, and then there's also one that I put in another one. You know, the old ones before I did the ones last semester. So this is Dr. Olenek and I doing it. So it's just a different voice. If you're sick of listening to me, you know, you can listen to her. She's a tiny little dynamo kind of person. The baby exam. The gestational age assessment, though they're all those videos. So the goal is to get those done within a week, okay? Because really you get credit, even if you're going to clinical tomorrow, you get credit for 2 full days of orientation. Okay, this is a 90-hour clinical course. So you're gonna do 6 days in the hospital and a simulation. And so your orientation and writing your care plans counts in that 90 hours. Okay. Okay, then let's flip to the other modules so you can see. Okay, here is inpatient. Okay, so I tried to make you a task list of all the things you have to accomplish in clinical. Hopefully that's helpful for you. Okay, here's just, you know, again, you guys are going, you're going to clinical, and we've talked about fertilization and reproduction, right? We haven't done any labor and birth or baby stuff, right? So I'm just trying to give you some videos to kind of visualize what that happens. And that cervical dilation is something that's hard to visualize. So this little ping pong ball in a balloon is like a little 5-minute clip, and it's very creative, okay? Oxytocin, you're gonna see patients that have PIT going. We never do PIT as a primary line. We always do it as a secondary line and insert it low so that we can control the flow and turn it off if need be. So you're gonna see how they're doing that. Here, remember we talked about the issues. Here's all of the topics. You're welcome to come up with another topic. Just, again, you want to talk to your faculty about it, you know, because it's boring if we have 3 people doing the same thing. You know, the point is to have some interesting discussion. Here's your data sheets for labor and delivery, postpartum, and newborn. They have everything you need in them, except for the newborn one. You're going to have to print out the Ballard sheet, okay? The Ballard counts for 5 points on your care plan, so if you don't turn in a Ballard, you don't have it, okay? Ideally, you're going to see the nurses do it, and you're going to be able to fill it in, or you can do it on your own. Again, I'm not as concerned about you actually being right on it, but doing a Ballard is the best way to learn norms for a newborn. And you will have to know those for the exam and for the final and for NCLEX. Okay, so this is the best way to do it. If for some reason you forgot to do a Ballard, there's that video on doing a Ballard, and so I've let students kind of fill it out as they've watched the video. Okay, you know, if you forget, and then we can't get you back in there. Okay. The formative evaluation. So we're supposed to do a formative evaluation halfway through. Well, you know, we have 6 hospital days, so a formative is due after the 3rd day, which I feel really good if I just know everybody's name by the 3rd day. I mean, you may not have done anything at all. So it's just a 1-page. I know this is not how you guys did it in fundamentals. It's probably not how you're going to do it in med search, but I have them filled in already for the faculty piece. so that you can just fill in your part and it's like a done deal. So again, your faculty may want to do it in person, or they might want you to upload it into Blackboard. Okay, same thing with your summative evaluation. All those S's, I'm going to assume that everybody's going to be satisfactory, and then we'll change it if it's not. Okay, remember that when you save it, if you upload it in Blackboard, I'm going to give you a way to save it so that I can just send it, email it over to Miguel for filing. Otherwise, the student workers have a lot of extra work to do. Okay. Okay, I'm going to show you I'm going to show you one of the care plan pieces so you can kind of see what it looks like. Okay, I got to share a different screen. Hold on.